Welcome to Health Hour, a session for you by Black doctors, hosted by the Caribbean and African Health Network. Ever sat in a doctor's office thinking, they just don't get it? Or search for health advice online, but you can't understand it? Felt unheard? You're not alone, and you found your solution with Health Hour. Every Saturday at 11 a.m. This is your space where Caribbean and African healthcare professionals speak about health with a focus on Black people. We tackle the topics that keep you up at night: mental health, chronic conditions, preventive care, sexual health, men's health, women's health, heart disease, and much more, all with the cultural context that matters, because our Black doctors understand the unique challenges we face. Here is what you can expect: real talk from doctors who look like you and get it, lived experience testimonies, practical advice, illness prevention and management tips, and a space of understanding without judgment. You also get to ask questions. Your questions drive the conversation. Health Hour, where community meets Black health expertise.
Good morning, everyone. Good morning, good morning, good morning. Hope you're all feeling well and energized. My name is Dr. Joan St. John. I'll be the host for this Health Hour today. I'm so delighted to introduce Dr. Itunu Johnson, who is a UK-based portfolio general practitioner who is a consultant in family medicine with over a decade of clinical experience. Dr. Johnson strongly believes in the biopsychosocial interaction that underpins health and well-being, and utilizing this approach, she empowers her patients to live their healthiest lives physically and mentally. And let me tell you, Dr. Johnson is a force, a vital force. She will bring energy to this subject that she's going to talk about today, because she brings energy and vitality to every subject that she speaks about. So I'm really, really delighted to welcome her. And she's going to speak to us about a condition called PMOS. And I was thinking about it and I thought to myself, it's like, you know, when things become rebranded or renamed. So Jif became Sif and Marathon became Snickers. Yes, well, you may have heard of PCOS, but you may not have heard of PMOS. And I'm going to leave it to Dr. Itunu to tell us all about this condition. It's not a new condition. It's a renaming of a condition, so it does what it says on the tin. So, Dr. Itunu, welcome.
Hello, thank you so much, Dr. St. John, for that wonderful introduction. It's a privilege to be here to share about this condition that so strongly and disproportionately affects our community. And I have shared before that this is a condition so close to my heart because I also live with this condition. So I'm going to just share my slides and just let me know if you can see my screen.
Yep, we can see it. Thank you very much.
Okay, so we're going to be talking about understanding PMOS, which we're going to find out is a whole body condition. It's not just ovaries and it's not just women's health. And it's a guide to taking your hormones, your health, and taking back your care. So, you know, this is who I am. It's actually 15 years I've been qualified now as a doctor this year, 15 years in this July. So it's been an honor and a privilege. And I'm like, oh my God, I'm hitting mid-career. Exciting times, just so grateful for the opportunity to be able to serve, because I really see this as service to the patients and to my community. And also I have, you know, lots of different qualifications in women's health specifically and the menopause. And, you know, I'm a very very passionate advocate for equity, health equity, diversity, and inclusion. And I also do quite a lot of teaching and education. But most importantly, I try to bring my own personal insight into the professional expertise that I have to let people know that I understand what it feels like to be a patient, because I myself have been a patient. So it's a change in the name. It's a change in the name, and hopefully that means we should be getting better care outcomes. We're so excited that this name has been changed, because PCOS, which I talked about last year on the Health Hour, some of you might remember, is a misnomer. You don't have to have polycystic ovaries to have the condition. And so the old focus made it think it was about just ovaries and fertility, but actually the new name, PMOS, polyendocrine metabolic ovarian syndrome, makes us realize it's about hormones, it's about metabolism. Yes, it's also about the reproductive system, but it's a whole body condition. It's not just an ovary problem, which means care must look at the whole picture. Now, what I really want us to think about is the myth. What do we see? Missing periods, a weight problem, fertility issues. But what is it? It's hormone abnormalities, insulin resistance, higher risk of metabolic conditions like type 2 diabetes, high blood pressure. It's also skin changes and hair loss, which can really impact, particularly in our community. It's anxiety, depression, and the mental load. So often we focus at the visible tip of the iceberg, but true PMOS care requires understanding the heavy, less visible currents that are beneath the surface. So there are really no stages in PMOS because each person has an individual path. Now we can look at, and that's still being researched, at certain phenotypes, which is certain pictures of how people manifest with PMOS. But really, I think for our benefit, as we're talking to the public, that's more of an academic discussion. When we're talking to patients, there really is no stages in PMOS as such. It doesn't necessarily get worse over time like a ladder. It's not like that at all. It's a fluid whole body condition that shows up differently in each person that has it. And the symptoms can shift, they can improve, they can change, or they can worsen based on your environment. And we're going to talk about some of that. So what are you putting in your body, how you're moving, all of those sorts of things, your age, and what you're using to manage your symptoms. And so because there are no stages, there's no one size fits all timeline or approach. Your care is based entirely on the specific symptoms that you are experiencing. So what are the impacts on Black women? So PMOS affects 1 in 8 of all women in the UK. However, we know that it disproportionately impacts women from Black, Asian, and minority ethnic groups who already face higher baseline risk. So much more likely to get metabolic syndrome compared to white women, so Black women. And this metabolic syndrome, what is that? That's the abnormal cholesterol, abnormal blood sugar, abnormal blood pressure. It's that unholy trio, which unfortunately disproportionately impacts Black women. Now, Black women are already much more likely to get high blood pressure just by the nature of being Black. And so it's more common to have that high blood pressure in PMOS. And Black women are more likely to have a higher BMI alongside higher cardiovascular risk. Now, we know that BMI is not the best tool for assessing weight in our community. But again, it's one of the tools that we have. But we also think about abdominal obesity. So that's fat around the stomach. And that's also known as visceral fat, so fat in the body and the organs, and that kind of fat really impacts metabolic risk. And we know that that's something that can disproportionately impact our community. So let's start with a few stories. So we'll start with Aisha. Aisha is 24 years old. She's had missing periods since she was 16. The doctor simply dismissed it as stress. She has developed dark velvety patches on her skin, and she has facial hair, which made her feel deeply self-conscious. She's avoided hormonal treatments because she's worried. She's worried about gossip. She's worried about stigma. Her mom has been like, Aisha, you cannot take the pill or any of those kind of treatments. It's not for us. It can make you infertile. And she's scared. After years of being told to just lose weight, she feels anxious and alone. And without proper care to shed her womb lining, she was eventually diagnosed with a thickened womb lining. And this thickened womb lining, thankfully at this point, it wasn't cancerous. But over time, if we're not bleeding regularly and you get a thickened womb lining, it can lead to womb cancer. And the truth about it is Black and brown women are much more likely to get womb cancer at a younger age when they have PMOS. So it's actually a deep health risk issue if we are not looking at the condition, diagnosing and putting things in place and explaining to women why it's so important that they have a regular bleed. And there are different types of hormonal treatment, and there's options that can work with each individual. And of course, how we communicate things makes it more or less difficult for the patient to hear what the doctor is saying, and then they can have that communication between the patient and the doctor, the patient being the expert in her own body and the doctor or nurse being the expert in the medical, so that they can come together for personalized shared care. And this is what we need to be trying to move towards so that we avoid complications like Aisha has experienced. Now, this is Anita. She's 38 years old, British Ghanaian. She's lived with irregular cycles for years before getting a PMOS diagnosis. When she struggled to get pregnant, she faced intense pressure from her family, from her in-laws, and it was incredibly difficult for her. And she was really worried that her in-laws were going to find her partner a different partner because they were so negative about the fact that she'd been unable to conceive. So she'd gone to various prayer houses and she was told to have faith. In the medical system, she felt invisible. She had reservations about IVF and frustration with failed, induction. And fertility clinics labeled her as difficult because, she had so many questions and so much, lack of clarity, and she just needed that kind of culturally competent support. And it's just like without the culturally competent support, the emotional pain, the silence, the stigma, the pressures that women who live with PMOS face is often very, very heavy. So how does PMOS show up? It can show up in all sorts of things. So irregular or completely missing periods, heavy bleeding, pelvic pain. There's skin manifestations, so dark velvety skin patches, acne, unwanted dark hair, weight changes, so gaining weight, persistent fatigue, hair thinning, or hair loss on the scalp. And this also with the metabolic changes that happen in the body that can mean increased rates of abnormal sugar control and insulin resistance, increasing risk of diabetes, increased risk of abnormal cholesterol, so high cholesterol, the bad cholesterol being high, and then also raised blood pressure. Now, not everyone has all of these symptoms. PMOS is entirely unique. Each person's experience is different. Now, I think it's important to just talk about how things look in different skin types. So many of the medical textbooks are based on white skin, and we're grateful for the fact that people are now starting to say we need to have these diagnoses seen in how they look on black skin or brown skin, because it means that clinicians can miss or misdiagnose these symptoms. So with the excess testosterone and androgens that happen in PMOS, you can get these symptoms that we call including hair loss, and the hair loss is usually kind of frontal, so kind of like a male pattern hair loss with the excess testosterone, and then acne. And we know that with acne in black skin, you're much more likely to get longer lasting dark spots, and that's called hyperpigmentation. And that scarring that can occur with acne, which can cause immense emotional distress and feeling stigma. And then we can also get these dark velvety patches on the neck or underarms, which is a classic sign of insulin resistance and not really noted by some doctors who are unfamiliar with diverse skin tones. So a major driver of PMOS with the metabolic connection is insulin resistance, meaning that your body makes insulin but struggles to use it effectively. And that then puts you at risk of things like increased blood sugar and high risk of developing diabetes, increased high blood pressure and high cholesterol. And then, of course, with this comes a higher risk of another condition that I think is so important to be aware of, because again, it disproportionately impacts Black and brown people, which is sleep apnea. And it can cause breathing problems, so stopping breathing during sleep. And this condition in of itself can just make all of these other things so much worse. So with sleep apnea, diabetes risk worsens on top of the other already increased diabetes risk. The risk of heart disease worsens, the risk of strokes worsen. So literally it becomes just such a horrible chain cycle that just makes things so much worse and worse. So we need to be thinking about all these risks, not just about periods, but of course the period issues are also important. But we're trying to have the conversation about things that haven't been talked about as much with PMOS. So that's why I'm focusing on these other aspects. So there's also the invisible weight. And for those of you who know me will know that I always talk about the mental load that women in particular carry for society. And of course, for Black women, there's that minority stress and allostatic load, which is existing in spaces that were not created for you. And then when you've got a condition like PMOS, it's even heavier, and it's often emotionally exhausting. And then separately, anxiety, depression, eating disorders, body shame are medical complications of PMOS as well. Then there are the cultural expectations. Women of color face immense pressure to manage home, look after sometimes 2 generations. Then there's what we call the Black tax, having to send money home to either the Caribbean or to Africa for people who are immigrants. And then there's the emotional care. And then there's the family expectation, particularly if fertility issues become a problem. And then there's the expectation to be strong. Black women, we're strong. Well, and I really want us to be challenging that idea, right? Strength also is saying it's too much. Strength also is saying I'm struggling to cope and seeking for help. Because that expectation to be strong is sometimes it's killing us with that additional fatigue, depression, and making it even more difficult, right? And these high stresses will then worsen the PMOS symptoms, make it more difficult to be able to put in the lifestyle changes that are so necessary, worsen the hormonal imbalances that underpin PMOS, which in turn creates more stress. So breaking the silence around the mental load, around allostatic, which is the additional load of being Black and carrying that stress of existing in spaces that were not created for you, and the minority stress, all of those things is important, and it informs trauma-informed care, which is part of what we need to be doing as clinicians to support our patient cohort. So how do we take back control? PMOS does not have stages, so there's no single universal treatment path. Your plan for your care is built entirely around the symptoms you want to manage. And we're going to look at a few pillars. So pillar 1 being lifestyle and well-being, and we'll talk about that in more detail. Pillar 2, protecting the womb, and this is really important for those with irregular missing periods. Pillar 3, metabolic health. Now, there are other things that are important, which is for those who are getting the skin-based manifestations, so things like hair loss, acne, having hair on the chest or on the chin, all of those things, there are treatment options for those as well. And then for those who are struggling with fertility, there's an other pathway for that as well. So it is based on the symptoms and what is triggering you. And then, of course, for those struggling with the mental health ramifications of PMOS, then we need to be thinking about the psychological support, treatments like cognitive behavior therapy, psychotherapy, all of those things to help with that as well. So let's start with lifestyle. How you eat is so important. But again, I don't want to impose any particular plan. It needs to be what you aligns with your cultural background, with your lifestyle, really. Foods that you can enjoy. It's about balancing and making sure that you are eating for the type of your symptoms to improve your symptoms. So what are the options, right? So firstly, you want to eat healthy, fiber-rich carbohydrates. So that means whole grains, so like brown rice or brown bread or brown pasta, or even our wheat foods, so like hard foods, wheat-based foods. But it's about portions. Now, from where I come from, and when we put food on a plate, we heap the plate with the carbohydrates, and then there'll be some small protein at the top. And so we want to be changing that formula. So you can still eat your local foods, but if it's, hard food, so, things like pounded yam or whatever you're eating, be mindful of the portions. And, you can make a pounded yam alternative with sweet potatoes, which might be healthier. And you can still eat your vegetable soups, but try and make it with healthier oils and put as much protein as you can. So what we would usually suggest is no more than a fist size of the carbohydrate. And the healthier the carbohydrate, the better, which means the more whole grain. And then Vegetables should be half the plate, and then protein should be the second quarter of the plate. So you need a lot of protein, but not all proteins are created equal. So if you do eat meat, your fish and your white meats like chicken are much healthier than your red meats like goat meat or beef or pork. So again, I'm not saying don't eat goat's meat. I'm saying be mindful. You can try and minimize that to maybe once every 2 weeks or something like that. And then also, how are you preparing? Are you frying with oil? You can use an air fryer, or you can grill it, to reduce the unhealthy fat content. So again, it's about how you're eating. Some people talk about time restricted eating. Now, it doesn't work for everybody, but for some people, they'll eat like between 9 and 5 p.m. And then outside that, they only drink water or black tea or herbal teas that have no sugar or honey or milk in them. And that's, called time restricted eating. Now, for some people with PMOS, they find this to be really helpful, but other people struggle with it. Ideally, you can, if you can't, if time restricted eating doesn't work for you, you just eat healthy, reasonable portions of meals 3 times a day, and be careful with snacking, because obviously the pressures, sometimes you're just feeling stressed. You're like, I just want to put something in my mouth. Okay, if that's the case, then let's try and put something like healthy snacks, that will not necessarily up the calorie load. So things like healthy nuts, things like high fiber, low sugar snacks, things like high protein snacks as well. But just be careful about the sugar content, because there's so much hidden sugar in foods that you really need to be careful about that, because that can increase insulin resistance. Now, when it comes to movement, it's so important that you do movement that brings joy and reduces stress. So again, I don't say, oh, go. I mean, there's recommendations by the government, we want people doing 150 minutes a week. But how you do that is so dependent on what works with your lifestyle. I often talk about busy moms. Why don't you put on some music? It could be some Afro beats or even Afro gospel if you're that way inclined. Dance with your kids. That is one way of getting movement. If it's walking, I talk about nature being incredibly restorative. So if it's walking, if it's swimming, if it's doing team sports, whatever it is that will bring you joy. But also don't forget about resistance exercise, because that helps fight back with improving your metabolism. Muscle is so important. So yes, there's cardiovascular exercise that's good for the heart. But resistance exercise is so good for your metabolism. And then, of course, there are relaxation exercises, things like Pilates or stretching exercises, or even yoga. I know some people in our community are like, I don't want to do yoga because of spiritual connotations. Well, you can just do the stretches. You don't have to do the spiritual connotations. But if you feel happy to do yoga, go ahead and do it. All of these things can, the 3 arms of movement are really important in bringing down stress and improving flexibility and all of these things for improved lifestyle. Now, sleep is so important. And I can't overstate how much sleep is. And the better rested you are, the better your hormones are balanced, and the better you're able to eat well and move better. But it's also about support. It's a village. It takes a village. Finding that support network is so crucial in terms of improving your lifestyle. And then obviously stress management, the heavy mental load, making sure that you are thinking very much about prioritization and being intentional about what you're carrying. Stop carrying extra loads that you don't need to be carrying. A very amazing occupational therapist taught me about elimination, delegation, and facilitation, which is remove what you don't have to do. Just remove it. Whatever you don't need to do, look at your life and just say, okay, no, I don't need to do this. And then what if you can get help, you know, the older children, maybe they can help with a few more things. Your partner, your community, if you have family that may be able to help you, use that, lean on your community. And then try and use modern technology in a way to make your life easier, to facilitate things as much as you can. But just be careful with technology as well, because one of the things that I talked about with lifestyle is what you put in your mouth, but what you put in your brain is also really important. What are you consuming? Are you just consuming TikTok rot? And just doom scrolling. Think about what the 24-hour news cycle, most of it is bad news. What is it doing to your mental health? The social media, what is it doing to you? How much of this are you consuming? Are you consuming healthy stuff that is going to help you with self-improvement, that is going to help you be a better person in your mind? Are you reading? Are you listening to helpful podcasts? Are you learning? Are you improving yourself? Just really think about what you're consuming in your mind as well as in your body. Now, I wanted to talk about something that's really important for our community, which is hormone hesitancy. I mentioned in one of the stories that we began with about the difficulties that some in our community face with worrying about hormone treatments. Now, I'll start by saying I get it. People are worried. It's unnatural. I'm worried about my fertility. Doctors don't listen to my side effects. These are real concerns. And not everybody needs hormonal treatment. If you've got PMOS, but you're having regular periods or at least one bleed every 3 months, you might not necessarily need hormonal treatment. So I'm not saying that everybody does, but if you are not having regular periods and you're not bleeding at least once every 3 months. And that is a health risk because it can increase your risk of womb cancer. And so hormones become really important. And so I know that past medical harm and dismissed side effects have fueled absolutely valid mistrust. But there's also myths and things that are just not true. And social media amplifies fears about hormones as well. And all those WhatsApps that we, forward to each other that are based on, mostly lies, make those things even more fearful. The truth is that you have the right to question your medication. I would never want you to feel that something is being imposed upon you. You have the right to your own body, but we can have honest, respectful conversations with your doctor or nurse to find a treatment that works for you and your body without compromising your comfort. We now have so many different hormonal choices that we didn't have before. We have body identical treatments in terms of pills. We have body identical hormone contraceptive pills that are available. It might be more difficult to get some of these on the NHS, but we do have them. And we have a whole wide range of progesterones that are available in order to treat that we can tweak in order to treat side effects that women may have with some of the combined oral hormonal contraceptives. And now we also have drospirenone, which is a standalone anti-androgen progesterone, which is a game changer. Now, it's not licensed for PMOS, but we know it's an anti-androgen. And actually, before we only had it in combination with estrogen as a combined pill. we know that it could be of benefit as a standalone progesterone, not for women who can't have the combined pill or don't want the combined pill. So again, we have so many different hormone treatments that can be helpful and really make a difference. I always tell my story about how I could have failed out for medical school because I was so afraid, because I had really bad periods and I was missing days out of medical school, and I was so afraid of taking the pill because of all stories I had heard. And even though I was a medical student, I still believed it. And it took a very kind tutor who was a gynecologist to sit down and listen to me and say, "Do you know what, Itunu? Why don't you try it?" And it was life changing. And I can honestly say that it's part of the reason why I'm sitting here in front of you, facing that hormone hesitancy and getting the treatment that I needed to make my life more manageable rather than suffering in silence like I did for so many years. Now, as I said, if you're not having regular periods, the lining of your womb builds up, and this can be dangerous and increase the risk of womb cancer. So it's so important that you have a bleed. The commonest way is a hormonal pill, and as I said, you can have the combined pill with estrogen and progesterone, or progesterone only. And as I said, there's a whole range of options. And again, the hormonal pill can help with unwanted hair growth if you choose the right progesterone, and acne. So it can help with all these other symptoms as well. Now, there's the hormonal coil as well that can be used to keep the womb lining thin and safe. But if you don't want daily hormones, you can take a short course of progesterone. So that would be either norethisterone or Provera, medroxyprogesterone acetate, to have that bleed at least once every 3 months so that you're at least bleeding. So if you don't want to take hormones every day, then you can just take the hormone to trigger the bleed so that you have a bleed at least once every 3 months to keep your womb lining safe. And then, of course, if you're dealing with insulin resistance, metformin is an option, and it can help improve that insulin resistance and help treat some of the metabolic effects. So it's worth trying for some patients, and you can have a discussion with your GP about this if you're struggling with insulin resistance symptoms. And sometimes it might even help with regulating the cycle. Now, there are other treatment options, and I think it's about holistic and long-term management. So there's treatments for some of the hair and so hair loss, acne, and unwanted hair as well. And so some of these symptoms I haven't mentioned on here, but as I say, the hormone treatments can sometimes help with the acne and the unwanted hair, but some people have laser treatments and things like that. But a lot of these things are not available on the NHS. Some people also use bleaching, hair bleaching, creams. Again, some of this may be available on the NHS depending on where you live, but that maybe doesn't work so well for darker skinned people. So the treatment options for these are quite limited, and it's frustrating. And I really share that frustration. Sometimes for these complex skin manifestations, the treatments are available privately. And, sometimes that's not fair because, there's an equity issue there because some people can't afford these private treatments, but we're still working on it and seeing what we can do. But then there are other things that are really important for holistic and long-term management. One of them is the weight management, and we've got now this new class of drugs called incretin mimetics or GLP-1 agonists. So we have tirzepatide, which is a GLP-1, which is also known as Mounjaro, which is a GLP-1 and GIP receptor agonist. We have semaglutide, which is also known as Wegovy, which is a GLP-1 agonist, or bariatric surgery referrals, so people who are really, really struggling with their weight. And we can think around weight management for this cohort of patients, but also thinking about psychological screening for anxiety, depression, and eating disorders. it's so important that we're providing emotional support because it's absolutely necessary. But we're not very good at doing that. We need to be better. And then, of course, thinking about long-term risk reduction, the new NICE guidelines that are going to be coming out. And in fact, just so you're aware, the consultations open on the 1st of July. Very exciting. So please go and have a look at it and put your own 2 pence if you've got a thought about the consultation. We're going to be they're going to be recommending that people with PMOS have annual monitoring for things like type 2 diabetes, heart risk, so things like blood pressure and cholesterol, and thinking about reducing the risk of endometrial cancer as well. Now, there's also supplemental interventions. The most popular one that people talk about is inositol. There's limited clinical evidence, but it's more or less has very little harm. So you can try it if you want to see if it will help with regulating the cycle or helping with the insulin resistance. It may help, but there's no strong evidence for it. So I think if you've tried it for 3 to 6 months and you haven't noticed any difference, then you can stop. But it's also quite pricey as well. So again, there's a lot of health equity issues sometimes with all of this. Now, with fertility care, I think one of the most damaging myths is that PMOS equals infertility. It's just not true. Not everyone with PMOS will struggle to get pregnant. And there is an optional pathway for those who are struggling to conceive. So there are medications like letrozole that can be used for ovulation induction to trigger ovulation if you're not ovulating, or IVF can be available. But don't let the doctors assume your only goal is having a baby. And some women are not trying to have a baby. Your health and comfort matter, irregardless of your fertility plans. It's not just about fertility. So what does culturally responsive care look like? I think it's important to realize that you deserve health that respects your identity, your culture, and your lived experience. It must be curious. So it's about your life, your environment, your stress, all the things that make up you, not just your medical symptoms. And we must take your beliefs into consideration. So your cultural beliefs, your religious beliefs, and take your pain and symptoms seriously. We must listen and validate your concerns. Then it needs to be trauma informed. So we need to understand the cultural pressures, the traumas, the minority stress, the historical medical mistrust. And it's about partnerships. As I said earlier, you are the expert in your own body. The clinician is the expert in the medical care. And then you meet together to build a treatment plan in clear language that fits your values and works for you and can always be tweaked. Don't give up. Now, we talked about PMOS. If you're going to the doctor and you're thinking, I may have PMOS, how do you get the right diagnosis? So for PMOS, it's a 2 out of 3 rule, which means you only need 2 to be officially diagnosed. And the 3 things is: 1, irregular cycles, so missing periods or not having periods. 2, high androgen hormone, so that's the testosterone hormone, which is shown either visibly by having acne, hair growth in unwanted places, or hair loss, or via a blood test. And the 3rd thing is polycystic ovaries. So that's just one of them. And it can either be seen on an ultrasound scan, or there's a new blood test called AMH, which will be coming out shortly, that can be used then as an alternative. Now, you only need 2 out of these 3 for a diagnosis. So I'm repeating this. You don't need to have polycystic ovaries to be diagnosed with PMOS. And so that means you don't need an ultrasound to be diagnosed. If you already have irregular periods and visible hormone signs like hair growth or acne, you have PMOS. You meet the diagnostic criteria. Ultrasound not needed. Okay, so I think that's really important. And a lot of doctors maybe are not as aware of this as they should be. And that's why it's been so beneficial to change the name. So advocate for yourself, ask for metabolic screening. Don't let the clinician only focus on your period. Say, I know I'm at higher risk of these things. Can you check my blood pressure? Can you check my blood sugar? Can you check my cholesterol? And they should be doing this at least once a year. Talk about your mental health. Talk about the mental load, anxiety, and stress that you're carrying. It is really important. And talk about a tailored plan for you that, don't let the doctor just impose their will on you. It must be shared decision making. And if you're not comfortable with something, ask, what are my other options? I'm going to close with saying you are the experts on your own body. PMOS is complex, and we have to face it that the healthcare system isn't always built with Black women in mind. But armed with the right knowledge, with culturally competent care, and a symptom-based toolkit, you have the power to thrive. That's the end of my talk.
Absolutely amazing, Dr. Itunu. Thank you so much. You always bring your passion, your shared experience, your empathy for people to whatever subject you're talking about. And we're really, really grateful to you this morning for sharing such fantastic knowledge and expertise. So thank you so much again. There've been lots of comments saying how good the talk was, how good the delivery was, and everybody can feel your passion. So we've got some questions, and I'd like to try as best we can to get through some of those questions. So first of all, somebody would like to know how you address or how the hair loss associated with PMOS can be addressed.
We can try anti-androgen treatments. So either the combined pill with anti-androgen. So there's 3 of them available on the market. Dianet, which has ethinyl, estradiol, and cyproterone. Yasmin, which has ethinyl, estradiol, and drospirenone. These are synthetic estrogens with synthetic anti-androgen progesterones. But we also now have Drovelis, which is a body identical estrogen called estradiol with drospirenone as well. So you can try. It doesn't always work, but you can try one of those combined pills. We also now have an anti-androgen progesterone only pill, which is called drospirenone, also known as Slind, the brand name. Again, not licensed, but you can try. But then there's other treatments like spironolactone, minoxidil, which is you can put on the area that is struggling. So that's a topical treatment. You can also, some women go ahead to take finasteride, but all these treatments have their own side effects, and some of them you can't use if you're trying to conceive. So you can go and see a dermatologist that specializes in hair loss, or you can be referred if you're really struggling. There's some treatments that your GP may feel comfortable to try, depending on whether your GP has expertise, knowledge in women's health or dermatology. Some may feel comfortable to be able to try certain treatments, but some may say you need to go and see a specialist dermatologist. Now, of course, in our community, sometimes people feel like I go to a dermatologist and they just don't understand black skin, black hair. There are a few dermatologists around, but a lot of them work in the private sector. And so it can be tricky, but I'll just give a shout out to Dr. 𝗱𝗿𝗄𝗯, who is, in my opinion, a leader and one of the best Black dermatologists we have in this country. And so she is someone who, if you're really struggling, you can go and see.
Thank you so much. So I'm going to try and give you some quick fire questions, if that's okay, just mindful of time. So somebody would like to know if you can get PCOS from fibroids. Now, I think I know what your answer is going to be to this, but I think one of the things I'd like to raise is that the person was diagnosed with fibroids because she's been learning to advocate for herself. And I think that's one of the messages that has come through really strongly in what you're saying. If we're talking about PMOS, 2 out of the 3 things, and you will notice because it will show up in your symptoms, the irregular periods, and then the things like, as you described, perhaps hair loss, perhaps acne. If you have those symptoms, you can advocate for yourself because your GP, your primary care practitioner, can make the diagnosis on that basis. So the answer to can you get PCOS from fibroids?
No, they're 2 separate conditions, but you can have PMOS and fibroids. And obviously, as
Thank
a
you.
Black woman, you are at very high risk of having both. Because, it's almost 80% of Black women by the age of 40 will have if at least a fibroid.
And so these are quick fire ones to you, Dr. Itunu. Can intense work pressure cause PCOS?
Intense work pressure and stress can exacerbate PMOS. We don't really know what causes these issues. And that's something that we need to do more research about. But certainly the heavy pressures that we're under can make these symptoms worse, particularly the metabolic imbalance. You will find that the more stressed you are, the worse the symptoms are. For PMOS, for the weight gain, for the metabolic disturbances, all of these things just worsen. And that's why I talked about Black women and the allostatic load and the minority stress, but it's a quick fire thing, so sorry.
No, no problem. So again, a really interesting question. Is there a genetic connection to developing PMOS?
There probably is. They're still trying to identify, but certainly the predisposition towards these kind of metabolic insulin resistance issues can run in families. So PMOS, diabetes, these sorts of, metabolic, fatty liver, what we call heart, kidney, and metabolic syndrome. It's a whole range of things and tends to be more common in Black and brown people. So we really need to understand why that is. So definitely we think that there's a genetic condition, genetic predisposition, but it's not like there's one gene. It's like probably a collection of genes and predisposition.
And now there's a question about the side effects of hormone treatments. And obviously, you've mentioned already in the talk many different hormone treatments, many different combinations of hormone treatments. So I don't know if you can say, remember, this is a quick fire, a few words about some, I suppose, general symptoms of side effects of hormone treatments.
Very much depends on what hormones you're taking. And I think the most important thing is that any side effect that you're having should be able to be managed by either changing the hormonal treatment or thinking about what the other options are. You shouldn't just be suffering with your side effects. Now, also to say that a lot of side effects settle. So I often tell patients, when you start this, you may feel like this, or you might feel breast tenderness, you might feel like your mood is a bit up and down, and then within a few weeks to months, it settles. So sometimes it's about just persevering and then it might settle. But of course, if it's persisting, then that needs to be looked into. And there's so many different options now that we can try and change them.
Absolutely. And Dr. Itunu, when is the NICE consultation coming out? So
So it
hopefully,
came out, yeah.
loads of people on this call, on this webinar, are going to actually put their 2 pennies worth in.
It came out on the 1st of July. So get in there, go and have a look on the NICE website, the NICE consultation on the PMOS guidelines. We're hoping that the guidelines will come out and their final format in December. And we're hoping that that's going to be a game changer for management of PMOS for patients and clinicians.
And you said absolutely rightly that it's important to have a bleed on a regular basis. And somebody asked, what about for people who have 𝗯𝗏, so the long-acting implant? Sorry, the intrauterine coil.
You already have something that's protecting your womb lining. So if you've got an implant, if you're on a progesterone only pill, if you've got a progesterone coil, all of those people are it's your lack of bleeding regularly is because of those hormonal treatments. And those hormonal treatments are keeping your womb lining thin and safe. So you don't need to worry about your lining. It's people who don't have any hormonal treatment, who are not bleeding for more than 3 months, that need hormonal treatment. So that can either be combined pills, progesterone only pills, the coil, whatever you prefer.
Absolutely. And someone has said that thank you very much for the excellently delivered presentation. They didn't realize about the associated risks of high cholesterol and blood pressure. And don't forget the glucose in there as well. Let me just add that. And one of the mottos I have is each one teach one. Dr. Itunu has shared some wonderful expertise and knowledge with us all today. You need to share that. You need to go and share that with your family members, whether that's your sister, your auntie, your child, your daughter, whoever it is. You need to share this fantastic information that she's given us. She dealt with the biological, she dealt with the psychological, she dealt with the social aspects of this whole body condition called PMOS. Now, remember, so don't put PCOS anymore, it's PMOS. Dr. Itunu, you have been fantastic, as always. As I said, you always bring that vitality, you always bring that passion, you always bring your expertise and your knowledge. Somebody would like to have the contact details for the dermatologist that you mentioned, please, if you wouldn't mind doing that in
So
the
I've
chat.
just put her name in the chat, 𝗱𝗿𝗲𝗸,
Excellent.
and you
Yeah.
can just Google her. She's, easily findable on the internet.
She is supreme. She really is.
She really is.
So as are you. So
Mhm.
I want to say thank you very much. And I'm going to hand over now to Natasha. I think we could have gone on for another hour. Dr. Itunu, thank you so much. And I'm sorry for the quick fire questions. I
Dr.
just wanted
St.
to make
Joan.
sure we wanted to get through.
Absolutely. Thank you so much, Dr. St. Joan. You are an inspiration to us all. Honestly, you are the generation that's pioneering, and we are following after your amazingness.
Thank you. Natasha, over to you.
Hello, hello. What a lovely session. Thank you so much for getting us updated with the changes within the treatment management and also the name of PMOS. Thank you for the time, really, and advocacy. I know that you're both really, really busy. And without you, we can't do this. We really can't. I don't know if people know, but Health Hour is 100% non-funded and volunteer-led. So yeah, it's great to have you here. So I'm just going to do share a little bit about apologies for the noise. We are commuting because we have an event this evening. We have the Black Healthcare Awards this evening. So we are just on the way to the venue. So let me just share my slides with yourselves. Apologies, trying to share my slides. One second. Let me do this. Am I sharing the slides in full screen, sorry? Yeah, thank you. So next week we have Health Hour. We have Health Hour every single Saturday. The topic is to be announced. Do keep an eye on our socials. We do this every Saturday and it's for our community. So you can be more knowledgeable in relationship to your body and your well-being and empowered with knowledge. We have our event today. The Black Healthcare Awards is taking place at the Royal Lancaster, London, in the Lancaster Terrace. So please, if you have your ticket, you have your ticket. We are looking forward to welcome you. Have a great time. We'll have a 3-course meal, live entertainment, loads of awards that we're giving out. It's a very emotional and beautiful night, and we'll look forward to welcome everyone this evening. Also, we are one of the partners on the Black Health on Black Health Legacy. At the moment, we have an event on the 11th of July from 10 a.m. to 2 p.m. You can see the address there. If you need any further information, you have the email research@can.org.uk, or you can scan the QR code to know more. It's really important to get involved with research so we can advance health outcomes for our community. So do get involved, even if it's to ask questions, get to know more. There is no commitment. Come and see us on the 11th of July. We take a very holistic approach to health in Cannes. We know that health is not just access to care, but is also the social disparities of health. So we have creative health services at the moment just in Manchester, but if there is any sponsorship out there, we'll do it also in other parts of the country. You can see the times and dates there. It's completely free. There's loads of beautiful stories from this creative health services. So do join. They have a great community going. We also involved with Windrush compensation scheme. So we at the moment have a project regarding providing one-to-one support in the Northwest in applying to Windrush compensation scheme. We have a team that is looking after it. So do contact advocacy@can.org.uk to know more. We're just here to support. Again, it's completely free, as most things that Can does for our people. Thank you so much for joining us today. Again, apologies for the noise. I understand that it's very noisy, but it's just proof that we really do everything to keep this session running. And see you next week. Thank you. Bye-bye.
And that's our time for today. Whether you joined us on Zoom, Facebook, LinkedIn, or YouTube, thank you for making the Health Hour part of your Saturday. We hope today's session gave you the right dose of health wisdom that you can share with your friends and family. When we share knowledge, we strengthen our entire community. Mark your calendar. Next Saturday, same time. Got a topic?